Hi, I'm Ellen Evans, the bariatric dietitian. This presentation will explain in detail the 10-day pre-op liquid diet for our bariatric patients. First of all, why a 10-day liquid diet? Remember, our surgeries are performed laparoscopically, that is, with instruments inserted into the abdomen. The surgeons manipulate the instruments watching a camera that has also been inserted into the abdomen, just as you viewed in the EMI. Things are tight in there, and the surgeons need to be able to see and safely maneuver the instruments to perform surgery. If your liver is enlarged, the surgeons may not be able to safely perform the surgery. The liver becomes enlarged either with disease, like fatty liver, or with excess food intake. Following a liquid diet for 10 days prior to surgery reduces the size of the liver and makes surgery safer for you. Also, the weight loss obtained by following the restricted diet reduces the overall amount of fat in the abdomen, again making the surgery quicker and safer for you. Most bariatric surgical centers internationally require a 10 to 14-day liquid diet before surgery. Please turn to the pre-op section in your nutrition handbook, usually the orange tab, and find the page entitled Full Liquid Diet. The full liquid diet consists of anything in a liquid form, including milk products. Other foods that are allowed include smooth, low-sugar yogurts, instant hot cereal, and sugar-free puddings. Here are some food suggestions for the full liquid diet. The mainstay of the full liquid diet, however, is a protein supplement. You should plan on having at least 2 protein drinks per day while you are on the full liquid diet. Not all protein supplements are the same. You should read the label and ingredient list of any protein supplement you are considering before you purchase it. Ingredients. After water, the next ingredient lists the source of the protein. This should say milk protein, or whey protein, or soy protein. Please do not buy any vegetable-based protein supplement or anything with collagen, gelatin, or hydrolyzed protein as the second ingredient. These are not quality sources of protein. Next, check the nutrition label for the amount of protein. Each serving should have at least 15 grams of protein, the higher the better, and not so much carb. Here are some protein supplement examples that are available locally that meet the quality criteria. For example, Premier Shake from Costco has 30 grams of milk protein and only 6 grams of carb. If you buy different brands or products online, use the same criteria in evaluating whether or not to purchase them. These shakes are samples of shakes that contain too much sugar and not enough protein to qualify as a protein shake for our program. Be sure to read all nutrition labels for any product you are considering purchasing. You may also decide to make your own protein shakes using protein powder. Essentially, the same criteria apply when evaluating protein powders, except that the first ingredient should always be either whey protein isolate, which is the highest quality, or whey protein concentrate, or soy protein. Again, do not choose vegetable sources like brown rice or pea protein, and never purchase hydrolyzed protein. Be sure the powder you buy has at least 20 grams of protein per scoop and less than 10 grams of carb per scoop. Buy a flavor you like or purchase unflavored whey protein powder, which is very versatile, especially after surgery. I have included a sample menu just to give you an idea of what and how much to eat to meet your nutrition goals during these 10 days. Don't forget the warm and savory foods such as creamed or blended vegetable soups and hot cereal. These will help you feel as if you are having a complete meal while you are on this diet. Be sure to get at least 1,000 to 1,200 calories and 50 to 70 grams of protein per day on this diet. If you undereat, you will not feel well and may have trouble sticking to the plan. Before your next visit to the bariatric clinic, please do a 3-day trial of the full liquid diet, keeping a calorie and protein log on a daily basis and writing it in your food journal. Once you know your surgery date, count 10 days prior to that date to start your pre-op liquid diet. You will have an opportunity to review this with the dietitian before the start date, or you can always call or email if you have any questions. Do you have any questions? Please feel free to contact me at the numbers on the slide. See you in clinic.